Gray with KTVI Fox 2. We are bringing you the SSM Health Ask the Expert Facebook event. This week, we are talking about organ transplant donation, specifically for pediatric patients. This is National Donate Life Month. April is, and of course, we're emphasizing awareness of organ donations, encouraging Americans to register as organ donors for organs, eye, tissue as well, and to honor those people who have saved lives through the gift of donation of theirs. Now, joining us now is Katie Grinkemeyer. She is a pediatric nurse practitioner at SSM Health Cardinal Glennon Children's Hospital. Katie, you're on the solid organ transplant team, right?
That is correct.
Okay. And tell us, I guess, what would be your message in National Donate Life, looking at it from a pediatric standpoint? What would be the message you'd like to get out for this month?
Yeah. So thanks for having me. So Dan, when we think about organ donation, so many people think about adults and needing organ donation, but kids are affected too. So we have multiple organs that kids need. And there's a lot of kids that are also waiting on the donation list and waiting for a life-saving organ.
What about an adult donating an organ to a child? Is that acceptable?
That is. So you might have heard the slogan, share your spare. So that comes with kidney donation. And so we have, when it comes to living donation, we can accept a adult size kidney for one of our PEDS recipients. So we have kiddos listed anywhere from 1 year of age up to 18 years of age. So we have a wide variety of sizes of kids that need transplants. So we accept organs, not just kidneys, but all organs from adult donors. So either cadaveric donors or living donors, like I said, in instance with a kidney donation. So it does depend on size, but adult organs work great in our PEDS population.
Are most of those adult organs usable for transplants for children? You say
they are.
Of them are, some of them aren't, I guess, but...
Correct. So everything is a case-by-case basis. And when it comes to cadaveric or deceased donors, we obviously have to look at size and height and weight, because that would impact the size of the organ. But when it comes to living donation, we're looking at similar things as well. So we're looking at the height of the person, the medical history, and then the size. And we're looking at what size and if it would be adequate to fit into our kids.
Okay. I want to remind our Facebook viewers that if you have a question or a comment you'd like to give to Katie, please go ahead and write it in, and it will be passed on to me, and I'll try to relay it to Katie as well if you have any comments about organ donations, or particularly when it comes to pediatric patients. Katie, what would be the most common transplant seen in pediatric patients?
So the most common pediatric transplant is going to be the kidney. The top three would be heart, liver, and kidney. But when you look at national numbers, the kidney by far takes over for the amount and the number of kids that are transplanted across the nation.
Is there a most uncommon transplant?
There can be. The pancreas can be transplanted in kids, and intestines can be transplanted in kids. There's some specialty centers across the nation that do those, but those aren't as common of transplants that happen in PEDS.
Yeah. Why do you believe registering as a donor is so important?
Oh man. So there's lots of reasons that organ donation and registering to be a donor is so important. So it gives you the opportunity to verbalize your wishes. Obviously, no one wants to talk about it all the time. It's not a common conversation, but when you're impacted by it, or if a family member needs one, or someone you know needs an organ, obviously then it starts to become a conversation. Or if you unfortunately lose a loved one, you're kind of forced into that conversation. So when you have that conversation proactively and you register to be an organ donor, you're helping your family members because you've made that decision, you've signed up, they're aware of your wishes, and then those wishes are able to be granted if you're deemed eligible to become a donor, at the time of death, if something tragic happens. So it's always great to kind of think about what you want, think about helping others, because you truly could save someone's life. You could save a kid's life. You could save a fellow adult life, just by your choice of choosing to donate your organs.
Yeah, and I guess in most states in the United States, an adult can register as a donor when they get a driver's license or renew their driver's license. And I guess it would be, and you kind of hinted at this just a moment ago, making your family aware of that decision. If you go to the driver's license office and get a new driver's license and you register as a donor, you better share that information with your family. That's critical, isn't it?
That's correct. Yes, we want you to register, but we also want you to have that conversation so that you can bring awareness to other people. There's lots of myths out there about organ donation, and there's sometimes that fear takes over. But when you can have the conversation and talk about it, it helps alleviate fears, it helps spread awareness, and just helps kind of so everybody is on the same page and aware of what you are hopeful for when that time comes.
In dealing with families on your organ transplant team, you must go through a lot of questions and concerns and emotional times for the family of a child that needs a transplant. What are some of those myths that you have to address?
So, it's hard when we are seeing it from the pediatric side. Obviously, we get to see the benefit. We get to see the receiving end of this life-saving gift. So we see these kids struggle either in heart failure, in liver failure, or, living their life on dialysis. And then we have to walk with the families of they're knowing that they're waiting for someone else's tragedy to happen, which is a difficult thing. It's an emotional thing. And it's something that our team works with them to know that it truly is a gift. Other people are making this decision to help someone else out. And it's awesome to walk with them and to see they're so thankful. They see their kids bounce back pretty quick because these kids are amazing. And, they get their transplant and we bring them out of the OR and parents already can tell a difference. They have color back in their skin with some. They're making urine for the first time if they've got a kidney. So they're able to quickly see those positive benefits of what this life-saving gift has given us. But with that comes emotions too, because as they're excited and they're happy and they're joyful, they're also realizing that someone that gave that gift is also struggling. They've just lost a loved one. So it's walking that emotional walk with them. But I can tell you, being on our end and seeing day in and day out what amazing stories come from donation, it's hard to explain or understand why someone wouldn't want to, because, we're able to see and show time and time again the amazing gift that someone gave, in their time of tragedy. So it's a selfless, amazing gift, and it's nothing short of a blessing.
Yeah, right. And Katie, who can be a donor?
Well, Dan, that's the awesome thing. So organ donation doesn't discriminate. Anybody can be a donor. So age doesn't really matter with medical technology and advances. We have older adults that are donating. And then even if a tragedy would happen to a child or a pediatric patient, they are also able to donate. So organs are an amazing thing, like we talked about at the beginning. Age doesn't really matter. An adult can go to a kid can, donate to an adult in time of death. So organs are pretty transferable. Obviously, there's a lot of testing and a lot of process that goes on. But once we are, once the donor is deemed eligible to donate, and the list is run, there's a lot of people that can benefit from that donation.
Did the COVID-19 pandemic have an impact on organ donations?
It did. We, time kind of stood still for a little bit. Donations were down. Obviously, there was lots of research that had to go in and looking at the safety and just transmission, because when we transplant a patient, we give them a lot of medicine to decrease their immune system so that they can accept the organ. So obviously that comes with risks for infection and transmissible things. And so we always were extra cautious when we are looking at organs and looking at the risk and benefits, because early on we just didn't know. We didn't know what would happen if we transplanted someone and they got COVID, or if the donor had COVID. So there was a lot of special precautions going into across the nation, just with people looking at what does transplant mean now during COVID. So obviously it still happened. There were some people that you just can't wait. We don't always have the luxury of time. And so we had to look at the risks and benefits of each case and the situation. And did we have time to kind of wait, or did we need to move forward, because that was going to give that patient the best chance for survival?
And I understand, as I've learned along the way here in the pandemic, and I think medical experts have learned recently as well, that an organ from someone who was infected with COVID wasn't automatically dismissed.
Correct. That is correct. Now, every center is different, but that was not an automatic for donation. So the organ procurement centers, the individuals that work on the donation side, they had a whole nother set of protocols and looking at everything, but it was not an automatic, because as many people have learned, COVID has affected many individuals in many different ways. And so just because you had COVID did not eliminate you as a donor. Now, each center on the receiving end could decide yes or no for that patient. And that kind of went back to that, do we have time? How does everything else look, and looking at it from a case-by-case basis, because obviously we all want what's best for our patients. And so just making sure we're going through all those safety checks to make sure we're getting and providing the best for the people that are waiting.
Yeah. Is there a cost associated with donating an organ?
No. So that's one of the myths that I was kind of talking about. That's something that people are fearful of, because they're worried, it would leave a cost on their loved ones, or even with living donation that they would have to pay for something. So no, with organ donation, either deceased organ donation or living donation, there is no cost to the loved one's family, or even to the living donor. If they choose to go through with living donation, they do not receive a charge for the procedures and the tests and everything associated with the actual organ donation.
Is there one organ donation that's more beneficial than the other? If it comes from a living donor or a deceased donor, does it matter?
So there are studies that have shown that living donation, especially in kidneys, has a longer lifespan. So that organ has a little bit of a longer lifespan. It's also shown that they have less chance of rejecting the organ or their body trying to fight it off, especially for the adult population, because there's so many people waiting on the list. That living donation is a huge blessing to those recipients, because it really decreases the time on the wait list. So adult wait list times are really long. So if someone's able to donate to a loved one or even a stranger, especially in the adult world, they have a huge blessing, because that is a much shorter wait time. Mm-hmm. For our pediatric kids, we love living donation because we're transplanting, toddlers and school-age kids. So if we can set them up with living donation and their graft or their transplant could last even longer, that's helpful to them. So it is shown that living donation does have a longer lifespan for the graft.
Okay. Katie, our producer Monica tells me that we may have a comment or a question from a viewer here.
Yeah, Fox Chavis, he wants to know if your blood type matters when it comes to being an organ donor.
Does your blood type matter when it comes to being an organ donor?
It does. So blood types will matter. That's something that will be looked into to decide who you would match with. But every blood type can donate. It's just you would be matched with the appropriate blood type for who would be the recipient.
I see, to make sure that you are a definite match.
Correct.
And oftentimes there are family members that donate. If a brother maybe donate a kidney to another brother who needs one, that's more of a perfect match, I guess.
So you're right. So family members and siblings are commonly thought to be the best match and suit, and very commonly they are. But what's awesome is you don't have to have any blood relation to donate. So, you or I could get worked up and match with multiple people that are likely waiting for an organ, but it usually starts with someone in mind or a reason to start the workup and to get looked at. But yes, everybody can be a donor, and you don't have to have a specific person you're going towards. Just helping others is kind of where it all starts.
Mm-hmm. I know in doing news stories, we have done some where the family of the recipient sometimes meets the family of the donor. Have you experienced that with at Cardinal Glennon?
I have. So I have chills just as you're asking it. So we've had a lot of those amazing reunification stories. So we've had family members. That is all case specific, family specific. They can write to the donor family. It doesn't go straight to them. It goes through us and Mid-America Transplant. And then we work to allow it to stay anonymous, because there's some families that don't want communication for privacy. But we have had amazing times where our families have been able to meet up with the donor family. We've had times where, we're part of that experience and where they get to meet each other for the first time. And that's a really moving experience, because like we've talked, it's amazing for both of them. The recipient family is obviously very grateful for their gift, and then the donor family gets to see how they've impacted that family and what has happened because of their decision. So we've got to see that. Also with the living donor, we've had people that have reached out because of social media, and have reached out and have met people for the first time because they were strangers, and have gone on to donate kidneys to people that they did not previously know until, the family reached out and made it aware that their child was in need of a kidney.
Yeah, what an emotional and, like you said, a kind of a unifying moment for both families to know that one family may be suffering from a tragedy, another family dealing with a sick child who now has a second chance at life. What a bonding moment for those people who may not even know each other.
Absolutely. And most of the time these families stay connected and they do stuff together, and it's like a new extension or a new arm of the family, for sure.
Mm-hmm. All right, I want to remind our Facebook viewers, if you do have a comment or a question for Katie Grinkemeyer, she is a nurse practitioner, a pediatric nurse practitioner at the solid organ transplant team at SSM Health Cardinal Glennon Children's Hospital. And Monica, we have another comment or question?
Yes, Lisa King has a question. She said she has an autoimmune disorder, and she wants to know if her organs would still be considered.
Lisa King has a question, wanting to know, she has an autoimmune disorder and wanting to know if she would still be accepted as a donor.
So there's a lot of things that need to be looked at further into if you can or cannot donate. So we, as the Pediatric Center, we team up with our living donor program through SSM Health St. Louis University Hospital. So they are able to provide us with our living donor aspect. So they work up everybody for living donation to see if they're eligible from our, to be able to donate. So Lisa, I would say reach out to your provider to see if that is something, there's a wide variety of autoimmune diseases out there, and I am no expert by any means on any of them. So reach out to your provider first, just maybe to ask some questions, just to see, because we obviously want to protect you as well. We want to make sure that the donors are in tip-top shape, because we don't want you to make a sacrifice as a living individual to one of our kids or another adult, because we want to protect both of you. So I would first reach out to your provider and talk to them. And if they don't see any concerns, then you can always check out our website at www.ssmhealth.com/cardinal-glennon/pediatric-transplant. And that there's a link on there that you can kind of fill out to look at, to see, to let us know that you would potentially be wanting to be a donor, and we can get you hooked up to the people that help us evaluate our donors.
Yeah. Katie, you just brought up a good point. What does the donor or potential donor have to go through before they actually make the donation? And then what do they go through in terms of surgery and recovery?
So that's a good thing. So when we're talking about living donation, we're talking about the most thorough head-to-toe exam that you've probably ever had in your life. So we are going to get you hooked up with our kidney specialist at SSM Health SLU, and have them do a thorough evaluation. So you'll get testing. We want to make sure your heart's strong. We want to make sure you're up to date on all of your procedures, that us adults have to be doing, make sure immunizations are good. So you're going to get a very thorough head to toe exam and testing. So most commonly it's doctor's visits, ultrasounds, some imaging of your abdomen, and blood work. And that will kind of help. And then if anything's found along the way, then we further look into those things. But then all of that information helps our team then decide if you're eligible to be a donor. The surgery itself is, in our situation, we once again work with SLU, and so most of our donors are admitted for a couple days and then discharged to home, and then they have follow-up to make sure that they too are continuing in good health and making sure that their labs stay stable and all of that. So that is all through our partnership. We still continue to focus on the pediatric side, and then we use our medical experts at SLU to help us with all of our adults and our living donors.
And what about recovery?
So recovery, that's a little different for everybody. From personal experience, we've had some of our donors that have been up and going in a week or two. We've had some other ones that have needed just a little bit more time for recovery. Most people are out of work for about 2 weeks and then are able to return to work with lifting restrictions and that kind of stuff. But once again, that's kind of on a individual basis, just depending on healing and everything in the post-op period. But most people handle the surgery very well, and they're very excited to do it. I think there's a good adrenaline going. Many of our donors come over to see the patients as they're discharged, so that's another fun reunion to see just that 2 or 3 day difference, and then able to see how well the kids are doing, and that's another emotional time for that donor and then the family as well.
Katie, I know that SSM Health St. Louis University Hospital is a nationally known organ transplant center. So if I understand you correctly, the pediatric transplants would take place at SLU Hospital right there. Is that right?
So our pediatric transplants actually happen at our hospital at SSM Health Cardinal Glennon, but the living donors happen at SLU. So the kidney would be removed at SLU, come to us at Glennon, and then our transplants actually happen here at Cardinal Glennon.
I see. Okay. How many children are in need of an organ donation?
So nationally, there's over 100,000 people listed, and that's pediatric and adult, and for all organs. So when you look at like the most recent data that's been published was the 2020 data, and that was 7% of recipients were pediatric. So you're looking at a smaller portion compared to the national amount needed, but it's still a large volume from the pediatric side that still are waiting for organ transplants.
Are children better equipped because they're children to recover after receiving an organ donation, and what about the medication in their life from that point on?
So we always say transplant isn't a cure, it's a treatment. So we're trading one disease process for another. But Dan, to see these kids from pre-transplant to even 24 and 48 hours post-op, it is like they just got a magic bean. I mean, the energy and the enthusiasm and everything, you truly see a new kid emerge. And so it's a lot of change that you see, and it's because they just start to feel good. You know, sometimes it's so hard for these younger kids especially to be able to tell us that they just don't feel great, but their energy levels are down and they just aren't able to do things, and next thing you know, they're up and literally jumping in bed in the ICU and ready to explore. So they're resilient. Kids are resilient for sure. But yes, I mean, it's just the beginning of their second life, you know, their second chance at life, but it doesn't come without a cost. I mean, they are on medications. They take a lot of meds. And that's something that they will take for the rest of their life, because we want to protect that organ that they just received. So many parents say it's a different way of life. But they're able to do so many things that they wouldn't have been able to do without that second chance. So, you know, we always say we are doing this to give you the best quality of life as possible. We're not promising it's not going to be easy. We're not promising there's not going to be bumps along the way, but we're promising that we're going to give you the best quality of life we can give you. And your donor is just the beginning. So it's a huge blessing. And then these families take on the new challenge. And it's very common. We have kids, you know, in school and playing sports. And I mean, we have kids that have grown up here and are now in college, or we had one of our transplant recipients come back and do an internship with us in hospital administration. So sitting at the same table with them, you know, once treating them and now being a part of the day in and a day out work at Cardinal Glennon. So it's really fun to see all of these kids thrive and do so well because of that gift of life.
Would the growth of a child who receives an organ impact the life of that organ and whether or not there'd have to be another transplantation?
So the lifespan of an organ is only getting better. With medical technology and advancements, the lifespan of all organs are improving. It doesn't mean that, you know, one kid is automatically going to have theirs for a lot longer or another. The lifespan, you know, some kidneys for sure have lasted like 40. I think the longest is like a 60-year transplanted kidney. Don't quote me on that, but the lifespan is definitely expanding. So we always tell them every day is a new day. You need to do what you can do, which is take your medicine, stay healthy to protect the lifespan of that organ. And so we tell them every day, if they do what they need to do, they're just giving themselves the best chance at keeping and maintaining that healthy organ.
Katie, we're running up against the clock here at the end of our time. Is there anything else you'd like to add I may not have asked?
No, I think the big thing with Donate Life Month is we love to have the conversation. It's not always an easy conversation to have, but I ask everyone to start a conversation, to talk with your family and your loved ones, because the last thing that we want is someone to be put in a situation where they have to make the decision. And we want to make sure that people are aware that a decision could help someone, and it could save one life, 6 lives, 8 lives. And so we just really want to get that conversation out there and raise the awareness that organ donation does amazing things, and it helps a lot of people, including our littlest tots that, you know, receive an organ transplant even at, you know, 6, 8, 9 months of age. So
and if somebody wants more information, where can they go to get that?
So you can look up our pediatric transplant website at SSM Health Cardinal Glennon. So it's www.ssmhealth.com. /Cardinal-Glennon/pediatric-transplant. And we have all kinds of links on there, and you can read some of our success stories and see the emotional roller coaster of fun that we're able to enjoy on our end to see how amazing these kids do, all because of organ donation.
Yeah, it must be rewarding work for you when, like you say, you can see that child who may not be so energetic one day, and a couple of days later, they're jumping up and down on their bed.
Absolutely. It is. It is for sure reassuring and rewarding to see how well they do.
Yeah. Okay. That is Katie Grinkemeyer. She is a pediatric nurse practitioner for the solid organ transplant team at SSM Health Cardinal Glennon Children's Hospital. Please consider being an organ donor. And if you do make that decision, please let your family know about that decision so that someone else who's waiting for an organ it can be treated successfully, and you may end up saving a life for sure. Katie, thanks so much for being with us. A lot of good information, and hopefully some folks will contact SSM Health and to get more information if they desire it. We appreciate your time and information.
Thank you, Dan.
Okay. All right. This has been Ask the Expert, brought to you by SSM Health. I'm Dan Gray. Thanks for being with us.
Thank you for watching Ask the Expert, sponsored by SSM Health.